You said that if you are elected president that you would like to repeal and replace Obamacare. Can you tell me what your plan would look like and how you would ensure that low-income families don't lose the access to the health care that they currently receive in New Hampshire?
Sure. Here's what I think, that there's no way that the government in Washington, D.C. should be running the health care system for the entire country. It makes no sense from a common sense perspective. Let's take our two states, for instance. We're about the same size. Look at us. We're about the same size geographically, right? But in this state, you got 1.3 million people. In this state, you have 8.9 million people. The differences in the problems between those two states on health care are really stark. So here in New Hampshire, when you have people spread out throughout the state, a lot of the problems with health care is access to health care by distance, that you can't get to the specialist or the type of place that you need to because it's such a long way away. In New Jersey, let me tell you something, we trip over a hospital every 4 miles. I mean, they're everywhere. We're so packed on top of each other. Our access problem is cost. So my idea is this: let's get rid of Obamacare and let's mandate that each state come up with its own plan that works for its state. So the things that work here in New Hampshire may not necessarily work in New Jersey the right way. And what happens with New Jersey and New Hampshire are much different than what should happen with Wyoming or Montana. I trust the governors and the state legislatures to make these decisions. And the other reason I like that is because you can have a greater effect on it. You can't figure out what's going on in Washington, D.C. and get to a Secretary of Health and Human Services or the President of the United States. But you know how we trip over hospitals in New Jersey? You trip over state reps here in New Hampshire, right? You got 400 of them, right? And they're everywhere, man. Everywhere I go, I see a state rep, right? And so the great thing about that is you have the influence then to be able to go to those state reps and the state senators and even the governor and say, this healthcare system isn't working for me. The access point for all of you is to make sure that everybody has access to care both financially and from where they live. We need to develop that kind of system in New Hampshire and in New Jersey. Ours is almost exclusively based on cost because when people can't afford to get insurance, they go to the emergency rooms. When they go to the emergency rooms, they get bad care because it's not consistent care, and it costs us a lot more. We wind up paying for it anyway. So let the states run these things. Remember what the Constitution says. Nothing, all the powers the federal government have are listed here. Everything that's not listed here goes back to the states. Well, I don't see health care listed in the United States Constitution. Let's let the states do it. I even trust Governor Hassan to do it the right way. And I don't trust Governor Hassan on a lot, but I'll trust her on this and your legislature to work together to get it done.
Quickly follow up, a lot of people are already in the system under the ACA. Is it realistic to scrap the whole thing, or are there parts that work where, you know, it can be managed into a...
I think it's absolutely right to scrap the whole thing. And if the states decide they want to keep certain portions of what's been done, that's up to the states. Let them make those decisions. The federal government should not be bigfooting into this area. And, you know, who really believes in this audience or any place else around New Hampshire or in the other states across the country that giving more power and more money to Washington, D.C. is a good idea? I certainly don't.
Thank you, Governor. Let's go to social media now.